Welcome to Healthy Conversations with Athens-Limestone Hospital, where we share practical advice and connect you with healthcare professionals making a difference right here at home. I'm Susan Claiborne, and joining me today are Mark and Jordan to bring a man's perspective to today's conversation. Zach Quintana, nurse practitioner with Limestone Medical Associates, is here to talk about a topic that affects many men but often go undiscussed: low testosterone and hormone health. We'll explore what low T is and how it's diagnosed, treatment options, and natural ways to boost energy and vitality. So, Zach, thank you for taking time out of the clinic to be here with us today. So, let's just kind of start. You tell us a little bit about kind of what led you to become a nurse practitioner.
Well, when I was in high school, I was part of a medical program, and it kind of warms you up to the medical field if you're interested, be it dentist, doctor, nurse, physical therapist, whatever there is. It kind of just gets you tiptoed into it to kind of get an idea. And I saw nursing as a good opportunity to be a potential gateway into other professions at higher levels. Originally, I wanted to do physical therapy, but I ended up going towards nursing. And then I ended up going to college to get my RN at UAH. From that, I went to go work at a general medical ICU. And then I eventually went to the perioperative area. And then I went into my graduate degree and got my nurse practitioner. From that point, I did a lot of critical care. We did a lot of acute care setting stuff. My first job out of school was cardiothoracic surgery. Did that for about 3 years. After that, I did some outpatient vascular stuff. And then from there, I ended up in internal medicine. And now my most recent endeavor was urology. And now I'm here at Limestone Medical Associates.
Okay. So, kind of what drew you to, men's health, hormone management, kind of focusing on that area?
So I was most recently exposed to that, obviously, at the urology clinic. I didn't really have much exposure to that kind of thing in my previous jobs. And I myself honestly did have some sort of predisposition, idea, and ignorance to the subject. And almost some would say possibly a stigma towards it. And then when I started seeing people from, oh, they're on testosterone, what is this really about? And you talk to these guys and you actually see their labs, what they were before, their treatment plan, and how they are and how they feel. And it's really a very rewarding thing to see. And a lot of men, I feel like, are underserving to themselves in terms of their health. So when you see them having a good response and are happy and having better quality of life, it's very rewarding. And so that's really what kind of got me exposed to it initially.
Well, I think that's why it's such an important conversation for us to have today, because I know women, we talk about those things all the time among each other. It's kind of an open conversation. We start talking about hormones so very early on. Um, and of course, when you start the process of having babies and the hormone cycles, and then we talk about later on in life and how all that changes. So we're kind of really open about it. And of course, in the last several years, now you see all these commercials on TV that are geared towards men. And you see these famous people who are promoting a lot of these, be it supplements or tests or things like that, towards men health. So I think we are starting to talk about it a little more. So, kind of, why do you think it's kind of important to have those kind of open conversations in our community?
Well, I think it's important to have the conversations, one, because it's a problem that I feel like as men in general, and me being a man, I feel like I have a little bit of insight on this as well. Sometimes we're taught, maybe not directly told this, but culture in general is just kind of like tough it out a little bit. I was just part of it, get over it, pull up your britches, keep going. But then, like, as the science is there, the deficits are noted, the side effects are there. But not just because of that, but I think it's important to have conversations of it because there are some things that are also marketed that can also be what I would say debunked and not really true as well. And I think those things specifically add and worsen the stigma that can be associated with testosterone deficiency itself. And I think it's good to have these conversations about it to kind of help weed those things out too.
So you spoke on stigma. So can you tell us what low testosterone really is? Explain that to us.
So the textbook definition in terms of treating the problem is having a total testosterone of less than 300 and having symptoms associated with it. You can have marginal testosterone levels, but literature states if it's less than 300 and you have symptomatic issues related to it, then it can be an issue that is treated with therapy. So that's really the textbook definition.
It's good information to know, especially being a man. So as we age, how common is that as we age?
So it depends on what resource you look at. I would say some of those studies I've seen, men greater than 30, roughly 20 to 40% can have a low testosterone. Now, of that group, there's a subset in terms of those who are symptomatic. I would say it's probably half of that. So just because you have a low testosterone level doesn't mean, oh, I need to be treated for this problem. This is causing a bad thing for me. That's not necessarily true. In some cases it can be, but that's a whole different conversation because there's other things related to that. But in terms of I'm lethargic, I have no libido, I have decreased energy, I can't get through a workout like I used to, and I'm 40 years old, what's up? Again, older than 30, roughly 20 to 40%. In that subgroup, half that is symptomatic low testosterone, which would be testosterone deficiency with symptoms that we would treat at that point.
So how should someone go about being evaluated or tested for that?
So it would just be lab work would be the first step. So we would check your total and free testosterone, check some other hormone levels, and then there's also other lab work associated with that. Includes liver function, anemia labs, and then PSA, which is prostate-specific antigen. Those are the standard initial lab work that we check.
All right, so let's talk about some of the causes. What are some of the most common causes of low T?
Well, that's a big answer in and of itself. So you have kind of different causes. Many things can cause it. Obesity and low sleep or sleep apnea are probably the two biggest killers that are associated with low testosterone. Increased visceral organ fat can lead to increased amount of testosterone being transitioned to estrogen, actually. So it doesn't necessarily mean that you're not having testosterone produced, but you're not having therapeutic levels of testosterone systemically because of the obesity and increased visceral organ fat. Low sleep, that's just your body's not getting rest. It's not getting good, rest. It needs to recover, and that's going to affect your testosterone. I have seen guys who work night shift, say they work in the hospital or whatnot, they work night shift. They'll get their testosterone checked. It's dismal, like double digits. And they're very symptomatic, obviously. And if I've had one or two have come off of that shift and their testosterone on its own will just normalize. So those two are probably the two biggest causes. Other things include chronic illness, high stress, high cortisol levels, related to stress. The hypothalamus and the pituitary stimulate two things: the gonads, which helps produce testosterone, and your adrenals, which help produce cortisol. So if you're in a high stress situation all the time, that pathway will lean more towards helping you compensate with stress and away from sexual hormone production. So all these things kind of help contribute to these things. Medications, even chronic opioid use, can contribute to low testosterone. Previous cancer, chemotherapy, previous radiation, these are all things that can contribute to low testosterone.
So not just age, but how do you, as we all get older, men or women, things just kind of start changing. And so it's kind of hard to sometimes know what is age or what is a medical issue, so to speak. So kind of how do you differentiate between kind of normal age-related decline and this true?
So as you age every year, your expected systemic testosterone levels, and also note that the diagnostic time frame of the lab draw is important too. Usually it's early morning lab check for testosterone, because that's usually when your testosterone will start to go up. So you want to kind of get a screenshot of what your level is doing at that point, because if it's low and it's supposed to be high, then that's the biggest indicator, because later on in the day it'll start to taper off. So obviously if you check it on later in the day, it'll be more expected to be low. But as you age, you can expect, less than 5% decrease in total systemic testosterone on an annual basis as you age, probably after 50 years old, roughly. So testosterone of 290, let's just talk theoretical. Testosterone of 290 in a 30-year-old man, they're going to be much more symptomatic than a 80-year-old man with a testosterone of 290, which I would consider pretty darn good at that age. So it also, you have to weigh out, what's your age? There's therapy associated. What are the risks associated with therapy? Age does play a factor in these things.
Okay. Well, I'm already learning something because I didn't realize the sleep kind of part, such a big part of that. And I know my husband has had this diagnosis, and I don't think we've ever heard that about the sleep. And he definitely has sleep apnea. And so I'm kind of in my head going, oh,
Is he wearing CPAP and everything?
has one,
Doesn't use it.
doesn't use
And
it.
so it's funny because I have a lot of guys who that's the same story. They have a diagnosis, say, this is probably causing this. I've tried it. I can't tolerate it. I get panic attacks. I can't, out of lack of any other option to address it. Because these are guys who are like, they're falling asleep, just sitting there at
That's
work.
how he was diagnosed.
And I'd say, maybe you should get this checked out. Well, then we ended up, ruling them in for therapy after a long discussion, and they do feel a lot better. Is that treating the underlying cause all the time? No, but definitely a big contributor.
So what does that therapy kind of look like? What are the treatments for this?
You will see there's multiple ways to administer testosterone. The most common ones that we use in our clinic is topical and injections. There are pellets out there, and a lot of clinics do pellets too. I have mixed feelings with pellets. It depends on who's placing it, the quality of the incision made of the pellets. It's hard to quantify and know how much you're getting in a certain time frame on something that's inserted in the subcutaneous fat tissue. What I can do is I can quantify and know the duration of therapy from an injection with a set volume and dose that I administer X amount of days, and check your lab values at a certain interval after your last dose. I can quantify that and know that's reliable. Pellets have been around for a long time. They're still used. People prefer them sometimes because they don't want to do shots. It's convenient. They don't have to go and do stuff as often. That's fine. A lot of times those are cash only. A lot of times insurance doesn't approve those. But then sometimes you have complications such as infections, whatnot. So I've never been a big promoter of pellets. I'm not against it. It's just if I had to choose one for my patient, it would either be topical or injections. Topical, the only thing you got to worry about with that is that anything it touches will be affected. So if you have kids, make sure you're wearing gloves when you apply, or if it gets on your hands, make sure you're soap and water afterwards. Injections, the only barrier to that is people just don't want to do injections sometimes, which I understand. Us in the medical field are kind of jaded. So, it's just a needle, who cares? But, you have people who sometimes pass out from a needle. So topical will probably be the more lenient way on that one. But injections are very good. They usually last, we can do once every 4 weeks, every 10 days, every 7 days. It just depends on how they respond to therapy. There's also fat tissue and intramuscular injections, depending on the brand. Fat tissue injections are usually once a week. Intramuscular can be weekly, bi-weekly, or once a month. It just depends on how they respond to therapy. There are oral agents, but you have to be careful with those because they can be highly toxic to the liver. They have a lot of complications associated with them. So we usually try and defer those. I've only ever seen one patient that was on that before, and he had already been on it for many years before I even saw him. So we continued that, obviously, because he was doing fine with it, but he had to be monitored closely.
Well, and talk about the monitoring, because am I correct in assuming that with this kind of treatment, you do kind of have to do some regular testing? Because I kind of remember that with my husband, I don't know, liver or kidney or something like that, testing every so often.
You do. So when we start therapy, you have a window that you need to repeat and reevaluate your lab values. So that interval is either 1 to 3 months. Usually I do 3 months. What we're checking is your PSA, your prostate-specific antigen, your anemia lab. So generally we look at your hematocrit, because hematocrit and hemoglobin usually correlate with each other and rise at the same rate. And then we look at your liver function panel. And then we look at your total testosterone, obviously. We trend those things, and if we need to adjust therapy, we do that. And then after we get you set at that interval and you're kind of in cruise control, minimum every 6 months after that.
So is that because it does increase your risk for prostate cancer?
It doesn't increase your risk for prostate cancer, and it doesn't cause prostate cancer. But if you have prostate cancer, it could potentially feed prostate cancer, as does estrogen with breast cancer.
Yeah, that's kind of what I was correlating that with.
Yep. And one of the few contraindications for testosterone replacement therapy is active prostate cancer, male breast cancer. I'm sorry, I said prostate cancer in a minute. We were talking about females there, so I mixed up. So active male prostate cancer, which I don't think a female would have prostate cancer, and then male breast cancer. And then if you have unstable labs to begin with, meaning you suffer from an issue such as like hemochromatosis and you have to bloodlet secondary to polycythemia already, because testosterone therapy can increase production of blood. We do have people who have to donate blood so often so that their blood levels don't get too high, because if your blood levels get too high, you worry about things like stroke, heart attack, that kind of thing. Is that common? No, because you're monitored. It's people who are unmonitored or aren't compliant with doing things that risk is increased. And then any type of hormone therapy, including birth control, that's a hormone, can increase your risk for thromboembolism. Again, not common, but it's there.
So for those of us trying to do a more natural approach to this, how important is things like sleep and exercise, how important are those nutrition values and things like that? How important is that to keeping a good, healthy testosterone level?
Very important. And I will say, I talked to you about that subset of people who have low testosterone, but they aren't necessarily symptomatic. I get a lot of guys who get fixated on, all the engineers in Huntsville area, they get fixated on this number. It's like, this number is a problem. I need to fix this number. What can I do? I don't want testosterone. I was like, well, there's ways to do it. First off, getting better sleep is one of the biggest things, and not only the most effective, but like the quickest response to a change you can do in your life that can help it go up quite a bit. Weight loss, if you're obese, obviously, that will dramatically increase your testosterone. I've had guys who did it on their own, repeat their labs, or above 300, they're happy, required no therapy at all. Good physical activity, good diet. There's other things that could be associated with low testosterone. Low vitamin D. Vitamin D deficiency can be associated with low testosterone. Having good zinc is good. And then increasing physical activity obviously can do that. And then having good sexual health, which turns into a thing of which came first, the chicken or the egg. Is my sexual health decreased because of my low testosterone? That kind of thing. So, but increasing sexual activity can transiently increase testosterone levels.
Okay. So in the event, you want to do this more natural way, and you start doing some of the things that you just recommended, exercise a little bit more, get more physical activity, how quickly could you see a turnaround if you change your lifestyle?
The fastest interval I would do is just a repeat lab check in 3 months. That's the quickest interval I would do. But the sleep and the weight loss are the two biggest things, and those are objective. There's studies shown people who get X amount of sleep have these low levels or poor sleep, especially if you have sleep apnea. Because even if you're sleeping, you're not truly sleeping. You're having apneic episodes. You hear these sleep studies with people saying, I stopped breathing 99 times while I was sleeping. That's not true sleep. So correcting
we'll be
that.
having a conversation.
Yeah. Yeah.
We're having a conversation about this. Well, and I know, in women, we're used to talking about like stress and mental health associated with our hormones. So I would assume mental health, mood,
Yes.
all those kind of things are
Yes.
associated in the men's side of that also?
Yes. And add to what you said too, decreasing stress can help with your testosterone levels too. But yes, a lot of people, when they come in with symptomology, it's not just decreased libido, it's not just lethargy or fatigue. Some people come in with low drive to do anything, low purpose. They sometimes feel depressed. And I've had one gentleman specifically, we've had to hold his therapy at different times, and he had bad depression when we had to hold his therapy. But when they get on this therapy, that will improve dramatically sometimes if they have a true deficit that it's causing it. That can help in a lot of ways, yes.
Yeah. Yeah.
And then when you help that part, it can help the people around them, wife, family, kids.
Absolutely.
Yeah.
Yeah. I was going to say that's the same thing. When women have their hormones kind of bunked for some reason, period of time or whatever. Yeah. What is it? Mama's not healthy. Nobody or happy. Nobody's happy.
Yeah.
It works the opposite also. Well, I can see that. So kind of talking about, prevention, community awareness, what kind of steps can men take, to protect their hormone health at different stages of life?
I think it's pretty consistent across all stages of life. I think the biggest things, and we're assuming we have a healthy individual, right? So good diet, make sure you're getting good sleep, manage your stress appropriately. The biggest thing is make sure you're taking your, good multivitamins so you don't have any dietary deficiencies or gaps. Try to reduce any fad diets where you might have bad dietary deficiencies in any way. But yeah, just basically having good physical activity, maintaining good weight, getting good sleep. And then if there's any deficits after that, those can definitely be worked up and evaluated if there's any ongoing deficiencies.
Is that a standard blood test that all men get, or is it something they need to ask for?
Usually your clinician will listen to you. And I've seen it more often that some of your primary cares are checking it more often. But I've had some guys where I'll say, oh, you're feeling this way. Have you ever had your testosterone checked? No. So I do recommend if you're a man and you're having these symptoms at all, and they've done the rabbit chase where they've checked all your vitamins, your B12, all these things, and it's all normal. Check your testosterone, make sure everything's not out of whack.
Makes a lot of sense. Makes a lot of sense. So what advice do you kind of have for men who may feel embarrassed or hesitant to bring this up? Because I know a lot of times we just think about this in the, sexual aspect, but obviously it's a whole lot more than that.
Yes. So just think of it as in terms of don't get wrapped up in the potential stigma around it too, because I think there is a stigma with it. And don't think that your health isn't important, because if your health is put aside, other people will suffer for it. I hear so many times, say in my previous position, working heart and lung surgery, he never went to the doctor until he was 4 years old. Now we got big coronary issues with blocked arteries. We're going to have, heart catheterization, XYZ. Life has changed after that in a negative way. This isn't like that, but in terms of quality of life, helping your mental health, having good energy just to have a good family interaction. We're not talking about we're trying to win Mr. Olympia type of energy. We're talking about if you just are tired, you have no drive to interact with people, that kind of thing. That can be resolved if it's related to a testosterone deficiency very easily. Also, don't be afraid to address it. And if it's something that I've noticed some men don't want to talk to a female about these problems, there are obviously male clinicians that you can seek care from as well. And that's a lot of what I do. So I would not put it aside. I wouldn't ignore it, because usually if there's something going on that's not normal, that means there's something wrong most of the time. I wouldn't ignore it. So you don't want it to get bad and worse and then have something happen that could have been prevented potentially.
Yeah, I agree. Well, and from a family standpoint, again, as women, we expect that support from our family for the things that we deal with, and so we have that opportunity to kind of give that back. Because, like I said, I'll be having that conversation with my husband, so he would feel a lot better, getting that sleep. So,
And I will say this too, I did not realize how many people are on testosterone therapy until I went to go work in urology.
Yeah.
And I had so many people I was seeing for low testosterone. And I had talked to other urologists, and I said, do y'all see a lot of testosterone? Oh yeah, we see a ton. There's a lot. And I will say a lot of service members, veterans, they have very low testosterone, very low. So that's kind of that subpopulation where they might fall into these other things. Cancer patients, I've seen that too. Their oncologists used to send them to me. Hey, their testosterone is this, can we start therapy kind of thing. So, people with chronic illnesses. We've talked a lot about just typical healthy men, what could be causing, but people with chronic illnesses. Yes, it adds another layer of, are you appropriate for therapy? But it's definitely worth looking into to see if there's something that can be done.
Yeah.
For sure.
Well, Zach, this has been some great information, very insightful for me. Susan, I can relate to your husband. Sleep is one of my biggest challenges, so I definitely see where I need to improve on that. I've got mild sleep apnea, and I've tried all the things.
You got
It's hard.
mild or mild?
Mine, it's hard. It's hard,
Yeah.
but it's very important. You've given some advice. Is there any more advice you want to give before we close out?
Or what else? What you want to share about other things that you?
I've seen a lot of people, so this is kind of off topic, erectile dysfunction.
Yeah.
I've seen a lot of people pay a lot of money for treatment for erectile dysfunction. And it's kind of funny how expensive it is sometimes. And it's wild to me because most of the treatment for erectile dysfunction is all generic now, but it's still expensive, or their insurance just won't cover it. That's probably what it is. But in any case, some of that is related to a testosterone deficiency. And if we replace that, which can be cheaper than that, they're off of all these other medications sometimes.
So just getting a good workup and understanding it
Yeah.
completely all the way
I think
around.
erectile dysfunction would be a low enough threshold for me to check someone's testosterone if it's someone who I don't think should have it.
And you're located at Limestone Medical Associates, right?
Yep.
And
Limestone
taking new
Medical.
patients?
Absolutely. Me and Dr. Baggs. Dr. Baggs is my collaborative physician. But yes, we're taking new patients for kind of men's health and primary care. Both things.
Okay. Well, thank you so much for being here with
Well,
us today.
I really appreciate you having me. I appreciate it.
Appreciate the information, and that's the purpose of this, provide that education. So we thank you.
Thank you.
Zach, thank you so much for joining us and shedding light on low testosterone and hormone health. To our listeners, remember taking charge of your health starts with asking questions and having honest conversations with your provider. Thank you for tuning in to Healthy Conversations.